Hi guys, good evening. I hope you are able to see. Everybody is able to hear me. Can you all see me? Can you all hear me? Quick feedback. Quick feedback. Good evening. Good evening. Hi guys. Good evening. One second. I think my page is not refreshed. Alright guys. Okay. What's happening? Good evening guys. Good evening. Yeah. Right, so as you can hear me, I'm a bit unwell. That's the reason I could not take the lecture yesterday as well. But we want to continue the series, right? So we'll try to push for it. I'll try to keep it crisp today. We'll try to revise as many topics as possible. But today I'm going to give you entry into another, a very different characteristic of the human body, and a lot of different things happening down there in a very less explored field in terms of surgery, and that is your thorax, right? So I'll be concentrating more on the disorders of the lung and the chest wall and the mediastinum, right? So these are the things that we're going to be concentrating on. So we'll be concentrating on the chest wall, we'll be concentrating on the lungs, we'll be concentrating on the mediastinal aspect. So today we'll just give you an outlook of what is basically a thorax looks like, right? So today's opening topic, we'll be talking about the anatomy of the thorax. And when we say the anatomy of the thorax, I would like to start with the anatomy of the chest wall, right? So when we talk the whole orientation of the chest wall, so when we talk about the chest wall, predominantly chest wall is made up of ribs. It will be formed with the intercostal muscle. Ribs, the intercostal muscle. Another muscle which is going to be adding here is going to be the serratus anterior group of muscle. So when you talk about the chest wall in general, the chest wall is made up of three components. There are ribs, the intercostal muscles, and the serratus anterior group. We all know the ribs is going to be in a pair of 12. The intercostal muscles will be present in between, and the serratus anterior group of muscles are going to adhere to the chest wall. Now, what is interesting about the intercostal muscles that we have to understand, that if you take this as the representation of the rib, now if I'm just taking you as one component of the rib, and let's say, so this is a cut end of one end of the rib that you can see, which is here. There's another rib which is going to be present here. So there's another rib which is going to be present here, and let's say this is also the cut end of the rib which is across here. Now, we all know there are intercostal muscles which are going to be gripping together so that the entire 12 units of the ribs that you have should act as one single unit, right? So the muscles that you have, the outermost layer that you will see is what we call it as the external, we call it as the external intercostal muscle. So there is a muscular membrane which is going to be present here, and this muscular membrane is what we call it as the external intercostal muscle, right? So the first layer that you will see, if I just flip it across, is going to be the external intercostal muscle. The first layer that you will see is going to be the external intercostal muscle, which is here. So this is your external intercostal muscle, which is present here, right? So just to be clear, when you flip this muscle off, this external intercostal muscle, when you flip it off, you have the next set of muscle. This is the internal intercostal muscle. External intercostal, then you have the internal intercostal muscle, which is here. This is your internal intercostal muscle. And the last one that you will see is going to be the innermost intercostal muscle. So this is your innermost intercostal muscle. So three layers which are going to be present, right? So the first one is the external intercostal, then the internal intercostal, then the innermost intercostal muscles are present. The three sets of muscle which are layered one after the other, right? So the first muscle that you can see, this is your external intercostal. This is your external intercostal muscle. This happens to be the internal intercostal muscle. This is going to be the internal intercostal muscle. And the last one that you have is the innermost intercostal muscle. This is what we call it as the innermost intercostal muscle, right? So you have the external intercostal, the internal intercostal, and the innermost internal or the innermost intercostal muscle, right? All these muscular arrangements are also quite important because as you dissect through during our plane, so you will see this is the external one, which you can see here. Surrounding this, you see this is the internal, and then you have the innermost, which is present here. So as you can see, this is the introduction to the innermost intercostal muscle, right? Obviously, these are your ribs which are present. Just for the sake of understanding, I'm just highlighting them again. So these are our ribs which are present across here, right? Now, what is interesting is between the internal intercostal muscle and the innermost intercostal, you have the neurovascular bundle. Now, in the neurovascular bundle, the first structure that you will see, which is going to be here. So when you look at the innermost, so this is the innermost intercostal muscle, right? Between the innermost intercostal muscle, which is here, this is the innermost intercostal, and let's say this happens to be the inner intercostal, which is present here. So between these two, if I just extend it across, between these two intercostal muscles, you see the neurovascular bundle going out. The first one is going to be vein, then you will see there is an artery, and then you will see that there is a nerve. So this is the arrangement that you have. So the most superior aspect is going to be vein. Below the vein you have the artery, and below the artery you have the nerve, right? So this arrangement is very important. It is called as the Van arrangement. That is vein at top. There is vein at top, that is the intercostal vein. Then you have the intercostal artery and the intercostal nerve, right? This is what we call it as the intercostal vasculatures or the neurovascular bundle. I can simply name it as the intercostal neurovascular bundle. This is the intercostal neurovascular bundle. Now, as a surgeon, why should I be aware of this? Now, I should be aware of this because whenever I'm going to enter into the thorax, I'm going to open it from the skin. I will go into the subcutaneous fat. From there, I'll be dividing the muscle, which we'll be talking about. Once you reach to the intercostal space, now I have my cautery tip. Do you want to put the cautery tip, or do you want to incise while going into the rib on the superior border of the rib or on the inferior border of the rib? Now, every time you will see all the neurovascular bundles which are going to exist, all the neurovascular bundles will be existing here on the inferior surface. There is a vein here, there is the artery here, and there is a nerve here. So in every segment, of the ribs, the inferior surface of the rib will have the neurovascular bundle. You don't want to damage them, because once it starts bleeding, again, see the intercostal artery, it is derived directly from aorta, right? and your intercostal veins, they drain into azygous veins on the either sides, and then from there into the SVC. So it is again going to connect to a systemic system, which is going to be quite important for us to understand, right? So I don't want these structures to be damaged. So hence all my incisions, when I'm entering into the thorax, I will always use the incision on the superior border of the rib. I'll take the superior border of the rib as my guiding point, and all my incisions will be made like this, right? So that I do not cause any harm, injury, or any other problem with respect to that of my, with respect to of your vascular injuries, right? So this is the first thing that you should know in the context of the intercostal muscles. Okay. So yes, serratus anterior is another set of muscle which is going to be adhered to it. As we go into the incisions, we'll go more detailed about it. Now, just to complete the discussion here from inside to outside when you look at it. So as you said, the outermost layer that you can see is going to be your external intercostal muscle. So this is going to be, let's say, your external intercostal muscle, which is the outermost layer that you have. Then you have the internal intercostal muscle, right? I'm just saying that, let's say this happens to be the internal intercostal muscle that is present here. After the internal intercostal muscle, then you have the innermost intercostal muscle, which is here. So let's say this happens to be the innermost intercostal muscle. This happens to be the innermost intercostal muscle which is present here. Now, just for the sake of understanding, if I just quickly label it across, this is the external intercostal muscle. This happens to be the external intercostal muscle. Then you have the internal intercostal muscle which is here. This is the internal intercostal muscle. Then you have the innermost intercostal muscle. This is the innermost intercostal muscle. And the minute we say what is the next layer, the first answer that you give is going to be a parietal pleura, which is wrong, because here you have a fascia, which is what we called as the endothoracic fascia. So the innermost layer that you will see here is going to be the endothoracic fascia, and this endothoracic fascia will now have another layer, which is what we call it as the parietal pleura, right? So this is what we call it as the parietal pleura. So this is your endothoracic fascia, and then you have the innermost layer is going to be your parietal pleura. It is going to be your parietal pleura, right? So this is the parietal pleura that you have. This is the parietal pleura. This is the endothoracic fascia. This happens to be the endothoracic fascia. So why this is important is, whenever I ask you, when you are going to put an ICD, that is intercostal drain, what are the muscles or the layers you are going to pierce while entering into the thoracic cavity? These are the muscles which are going to be pierced. So if I quickly label them, this is the external oblique, so the external intercostal muscle. We call it as the external intercostal muscle. Then you have the internal intercostal. So okay, we'll not use abbreviations, slight confusing here. Also, we'll just shift it a bit down. Give me one second. Okay. So bring this a bit down. Right. So this is going to be your external intercostal muscle. This is the external intercostal muscle. This happens to be your internal intercostal muscle. Your internal intercostal muscle. Then you have the innermost intercostal muscle. the innermost intercostal muscle. Then you have the endothoracic fascia. And then you have the parietal pleura. Then you have the parietal pleura, right? So these are the various layers that you have to pierce in order to enter into the thoracic cavity. Now, another very important thing is about the lungs. So this is basic of your chest wall that we should be aware of. Now, when you go into the lungs, I hope everybody is clear with this. Okay. Now, let's go into a very, very important concept of the lungs division, which is called as the bronchopulmonary segments. So we're going to divide the lung into the bronchopulmonary segments. So when I say the bronchopulmonary segments, I'm going to divide the lungs in general into different smaller segments like we do in liver, right? So remember, total number of segments that you have are going to be 19. There are 19 segments in the lungs which are going to be present, right? So we all know the development of the lung. You have seen in the embryology. It starts from the foregut, a primitive foregut, which arches into the pharyngeal wall, which then goes into the esophagus, and the anterior one divides into tracheal bud that bifurcates and develops into lungs as it goes. Now, let's understand what are these bronchopulmonary segments. Each individual segments of these lungs are going to act as independent units. So we'll try to understand that what are those units and how they're numbered. Okay. Now, if you look at the bronchopulmonary segments, let's take this as the representation of the lung. So this, I would say, this is the right side of the lung, and this is going to be the left side of the lung. So as you can see, the left side of the lung is compressed. That is because the heart is taking place. So during the embryonic development, heart occupies, or the mediastinal space occupies the space, hence compressing the lung. Otherwise, they both were equal. Everything was same. Nothing has changed. It is in that context which has, during the development, has slightly been vary off, right? Now, just to get an objective here. So this is how the lung would look like. So just to give you a three-dimensional image. Okay. So this is the right and the left lung that is going to be present here. Now, on the right side of the lung, there are two fissures which are going to be present. One is going to be your oblique fissure, which is going like this. Another one is going to be, sorry, this is a transverse fissure. Another one is your oblique fissure, which is going like this, right? Here in your left lung, you only have the oblique fissure. The transverse fissure is being engulfed. Okay. So this is your transverse fissure. This is your oblique fissure that is present on the right lung. This is the oblique fissure that is present on the left lung, right? So this happens to be your right lung. This happens to be your left lung. Simple. Now, the right lung, or the right side of the lung, is divided into three parts. This is what we call it as the upper lobe. This is what we call right upper lobe. This right in the center, dead in the center, is what we call it as the middle lobe. And this one is what we call it as the lower lobe. The left side does not have a middle lobe, but then there is something equivalent to the middle lobe, which is what we call it as a lingula, right? So you will see something equal to that of the middle lobe, that is called as lingula. So this is what we call it as the upper lobe, that is left upper lobe. There is no lower lobe. This is what we call it as the lingula. And this is what we call it as the lower lobe. This is what we call it as the lower lobe, right? Now let's understand how they have 19 different bronchopulmonary segments. Again, in the same context of this, when you look at the division, the upper lobe is divided into three distinctive zones. So you have the one that is present on the top is what we call it as apical. right? And you have to draw Y-shaped segment so that you know all the components are answered, right? Now, this you can see is dead in the upper part. So this is the first segment, this is the second segment, and this is the third segment, right? So it is divided into three segments, 1, 2, and 3. What is 1? Number one is going to be your apical segment. So this is what we call it as the apical because it is on the apex. 2 you can see is on the behind, that is the posterior aspect. So this is the posterior segment. And 3 is on the anterior, so this becomes the anterior segment. 3 is on the anterior, so this becomes the anterior segment. So the upper lobe of the right lung is divided into 3 segments, the apical, the anterior, and the posterior. Nothing spectacular about it. The middle lobe, this Y extension will continue in this manner. Now the middle lobe is divided into 2 parts. One is medial, another one is lateral. So one that is medial, I have to number them. So the numbering, lateral is 4, medial is 5. So this is what we call it as the medial segment. And number 4 is what we call it as the lateral segment. Number 4 is what we call it as the lateral segment. So until this, there is no confusion at all because the Y is going, 1, 2, 3. So 1, 2, 3, everything lateral will be numbered first. You can see posterior is numbered first, the lateral is numbered first, and the medial one, the anterior and the medial one are numbered later. So 1, 2, 3, 4, and 5, as simple as that. Now coming to the lower segment. Now this is where it gets slightly trickier, but we'll try to navigate through. So this Y finishes here, giving it to one specific segment, and this is what we call it as the segment 6, right? The segment 6 is behind the middle lobe of the lung. That is a very, very important point. Then you see on the anterior aspect. On the anterior aspect, you have these 2 lines which will be drawn, which will divide the lung, right? So one that is present on the medial aspect is going to be the medial 7th one. Anterior basal is 8, your lateral basal is 9, and the 10th one is right at the base itself, right? So what is segment 7? It is what we call it as the medial basal. It is the medial basal segment. 9 is what we call it as the lateral basal. 9 is what we call it as lateral basal. 8 is nothing but your anterior basal. Your anterior basal, and 10 is what we call it as your posterior basal. 10 is what we call it as your posterior basal, right? So you can see now the 6th one is missing. The 6th one is what we call it as the superior apical, or the superior segment, or the superior basal, right? So this is how your 10 bronchopulmonary segments of the lung is being divided across. Just for the sake of understanding, if you want to have a little bit of more component, I'll just try to give you a more enhanced version, but this is how you're going to number it. Same thing we are going to follow on the left side, nothing changes. We draw the same Y which goes in the same divisional status, which is going to be here. Right, the same divisional status is here. Again, we'll number this as segment 1. Obviously the posterior one is going to be the second one. This is going to be the third segment. Now what is interesting here is the lingula, because it naturally does not exist, it is what we have created. The lingular division is going to be in this particular manner. Superior lingular and inferior lingular, it is 4 and 5. So again, quickly naming them. So we have the apical segment on the left side, which is here. Then you have the posterior segment, which is 2. 3 is going to be anterior, which remains the same here also, right? 3 is the anterior. 4 is superior lingula. It is the superior lingula and the inferior lingula. The superior lingula and the inferior lingulas are here. So you have the superior lingula and the inferior lingula. So inferior lingula is 5. I'm just lumping it here. Okay. Now same thing, the basal ones are going to be divided. This is your S6, that is your superior basal, which is going to be present. This divides dead into center in this particular form. Right. So this is your segment 6, which is present. Right. This is your segment 6. Now this is your anterior basal. This is your lateral basal. The medial basal does not exist. The reason why the medial basal does not exist is during when the heart is taking no. So medial basal is formed by 7. So obviously अगर 7 यहाँ पे है and when the heart takes over it compresses तो 7 पूरा पिचक जाता है. 7 exist ही नहीं करता. ठीक है. So as it compresses it completely, the 7 disappears. Beta, this is a surgical lecture only, but every time we start a new system, we give you the basic surgical anatomy of that particular system and then move forward. मैं नहीं चाहता कि मेरे बच्चों को ये ना पता हो कि anatomical orientation ही क्या है. ठीक है. Then this is your segment 10, which is your posterior basal. ठीक है. So 6, which is present here. 6 is nothing but your superior basal. Your superior basal. 9 is nothing but your lateral basal. 8 is your anterior basal. And 10 is your posterior basal. So if you look at all the segments, on the left side, कौन सा number नहीं है? It is the 7th one. Remember the medial basal. The medial basal disappears because when the heart takes this space, when the heart takes this space, this mediastinal space, when it occupies this space, it eats into your medial basal segment. ठीक है? So this is altogether 19 bronchopulmonary segments. जिनको थोड़ा confusion है, उनके लिए वापस reconstruct कर देते हैं. This happens to be your right side of the lung. This happens to be the left side of the lung. This arch that is created on the left side is because of the heart, that is your heart recess that is present here, which is going to eat up into it. We'll keep it very simple. There are two fissures which are going to be present. One is going to be a transverse fissure, another one is going to be an oblique fissure. Remember, left में सिर्फ oblique fissure होता है. ठीक है? Now all that you have to do is draw a Y segment और इस Y को extend भी करेंगे. ठीक है? So this is how the Y segment is being drawn and then it continues across here. इतना ही simple है. ठीक है? Here you will see that there is a lingular segment which is going to be present. यहाँ पे भी you'll draw the same thing. There will be a Y segment that we're going to draw, which is telling you how it is getting divided, and this continues across here. The lingular segment is going to be divided transversely. So each one of them have their own arterial supply, their own venous drainage. They also have their own bronchial supply. ठीक है? Now, as you go, this is going to be your S6 division that we have already spoken. फिर दो line यहाँ मार लेना, just to tell you that we are dividing them into the basal segments. Just to get a grip कि नीचे वाला जो posterior basal है वो कहाँ पे है. For that we are creating across here. ठीक है? In the same thing, this is in the same aspect, which is going to be like this. Here, all that you have to do is to draw a line which is going to be crossing across here. In this particular side. That's it. So now number it. The first segment is here, 2, 3, 4 is lateral, 5 is here, 6 is here. Then you start with 7, which is here, 8 here, 9 here, and 10 here. Same thing here, segment 1 is here, 2 is going to be पीछे, 3 आगे, 4 ऊपर, 5 नीचे, 6 is going to be here. 7 does not exist. So this becomes 8, this becomes 9, और नीचे वाला becomes 10. As simple as that. ठीक है? Nothing spectacular about it. These are all your bronchopulmonary segments. अगर quickly label करना है, the one is the apical segment. 2 is the posterior segment, 3 is the anterior segment, 4 which is going to be present, which is the lateral part. This is the lateral segment. 5 is the medial segment. 6 is your superior basal. 7 it is going to be the medial basal. 8 is your anterior basal. 9 is going to be your lateral basal. It is your lateral basal. 10 is your posterior basal. 10 happens to be your posterior basal. Okay? Same thing, you go on the left side. 1 is your apical segment. 2 is your posterior. 3 is your anterior. 'This is your superior lingula. 5 is your inferior lingula. It is your inferior lingula. 6 happens to be the superior basal. 6 happens to be your superior basal. 7 does not exist. 8 happens to be your anterior basal. 9 happens to be your lateral basal. And 10 happens to be your posterior basal. 10 happens to be your posterior basal. Okay? So this is how you divide your entire lungs into 19 bronchopulmonary segments. These are your 19 bronchopulmonary segments, right? Another very important aspect from a surgeon's point of view is the hilar anatomy. So we'll quickly go with the hilar anatomy. So conventionally, जब भी कोई भी आपको हाइलर एनाटॉमी पढ़ाएगा वो बोलेगा कि पीछे से देखते हैं, ठीक है. हम सर्जन्स हैं तो वी वुड वांट टू सी एज वी एनकाउंटर इट ड्यूरिंग द सर्जरी. तो हम सर्जरी के दौरान कैसे देखेंगे वैसे देखेंगे, ठीक है. तो अपना ऑब्जेक्टिव बड़ा सिंपल है. अगर हाइलर एनाटॉमी आपको एसेस करनी है तो हाइलर एनाटॉमी इज गोइंग टू बी इन द ओरिएंटेशन ऑफ अ सर्जन. मैं पीछे से नहीं आगे से दिखाऊंगा. व्हाट डू यू मीन बाय दिस, ठीक है. नाउ अगेन फॉर अ हाइलर एनाटॉमी विल टेक बोथ द लंग्स अक्रॉस. मान लीजिए कि ये आपका राइट लंग है. Now if I have to expose the hilum, this is the hilum of the right lung, ठीक है. तो आपने लंग को ऐसे घुमा दिया, ये पूरा हाइलर एक्सपोजर आ गया, ठीक है. सेम थिंग वी आर गोइंग टू डू इट ऑन द लेफ्ट लंग ऑल्सो. So this is the hilum of the left lung, ठीक है. Now when you look at the hilum, so I'll just label this. This is the anterior part of the lung. So just for the sake of understanding that we don't sway it around, we'll say that this is going to be the anterior part of the lung. So I'm just shading it so that you have an idea कि ये जो part है ये anterior है और इसके पीछे जो hilar है वो posterior surface है, ठीक है. So this is the anterior. This is the anterior part of the lung, ठीक है. So I've picked it up. So this is the anterior surface of the lung, which we can see. On the either side, you can see that this is the anterior surface of the lung. Okay. Now, from the posterior surface is what we are more interested on. Okay. तो ये जो surface है, this is your hilar surface, and this is the anterior surface. Right. So when you look at the hilum per se, what are the structures that you're going to encounter? Now the medial most, that is on the posterior aspect, you will encounter is going to be the bronchus. Okay. Between the bronchus, you have your pulmonary artery. So this is where you have your pulmonary artery. Behind the pulmonary artery, you have the superior pulmonary vein, and this is your inferior pulmonary vein, right? Now, you'll also see along with the bronchus, there's a vessel accompanying. This is what we call it as the bronchial artery. And then you would see the orientation on the other side. So same thing, you will see that there is this left main bronchus is there. You will notice that you have the bronchial artery. So there are two bronchial arteries on the left, and right will only have one single bronchial artery. Okay? Then you have the pulmonary artery, which is just behind it. This is the pulmonary artery. This is your superior pulmonary vein. This is your superior pulmonary vein, and this happens to be your inferior pulmonary vein, right? So if I just simply label them across, so this happens to be the right main bronchus. So we'll just tag it across here. This is the right main bronchus. This is the pulmonary artery. This happens to be the pulmonary artery. This is your inferior pulmonary vein. This happens to be the inferior pulmonary vein. This is your superior pulmonary vein. This happens to be the superior pulmonary vein, and this is your bronchial artery. This is your bronchial artery, right? The same thing you can see on the other side also. So this is your bronchial artery. This is your left main bronchus. Then you have the pulmonary artery. This happens to be the pulmonary artery. This is your superior pulmonary vein. And this happens to be your inferior pulmonary vein. This is your inferior pulmonary vein, right? So these are the hilar structures. So you should know what you're going to encounter if you're coming from anterior. You know, अगर आगे से आ रहे हो तो पहले superior pulmonary vein है, फिर pulmonary artery है, फिर bronchus है. अगर पीछे से आओगे from the posterior approach, right? So this is the anterior surface, and this happens to be your posterior surface. This happens to be your posterior surface. So anteriorly, these are the structures that you're going to encounter. Posteriorly, these are the structures that you're going to encounter. So hilar anatomy is very, very important. You cannot afford to miss on that. Okay? Okay. So this is all that you should know in the context of hilar anatomy. Now, just for the sake of understanding, as we move across, we'll talk about a little bit on the bronchial trees and segments so that you will understand it better. So there are two terms, that is hyparterial bronchus and the eparterial bronchus. I just want them to be just introduced. I'm not going to go into greater details here, but we'll try to reconstruct it here. Now imagine like this is the trachea that bifurcates into two segments. One is your right main bronchus, another one is your left main bronchus. Now you can see the right main bronchus is quite straight and left main bronchus is lifted up. The whole reason why this happens is during the embryonic development, it is where the mediastinum is going to occupy space. Now when the mediastinum is developing, it is going to push the left bronchus. As it pushes, the left bronchus is going to be at a more acute angle when compared to the right bronchus. Now what is interesting is, as soon as your left main bronchus comes, the first takeoff occurs, that is going to be for the right upper lobe, right? So from there, it is going to bifurcate into your anterior, your posterior, and your apical. That's we have already read. The three divisions which are present, one is going to be apical, another one is anterior, another one is going to be posterior. We're not going to go into greater details into it. Now this is now going to continue into bronchus intermedius. Now this bronchus intermedius is now going to give rise to medial and the middle lobe and the lower lobe. So this continues as the middle lobe and the lower lobe. The middle lobe has two segments, as you can see, the lateral and the medial aspect. And then you have the lower lobe. Now lower lobe has following segments which we have already discussed. So one thing that you will understand from the lower lobe's takeoff on the medial aspect, the first takeoff is going to occur here, and this is for your S6. You remember S6? That is your, what was the S6? It was superior basal. ठीक है, superior basal का जो take off है वो यहाँ पे आएगा. Then it is now going to further bifurcate into its rest of it, right? So we see the S7 and S8 as going to have a common origin. So I'm just not going to go into greater details of it. So nobody is going to ask you about all this, because then you have the S9 and S10 will have a common origin. So if I have to number them, no, as they have moved, because I've given S6, I have to number them. So this is going to be S1, that is apical. Then you have S2, which is posterior, S3, which is anterior. This is going to be S4, which is lateral, S5, which is going to be medial. S6 is here. Then this is your S7, this is S8, this is your S9, and this is your S10. Okay? So this is the orientation that you have for the tracheobronchial tree which is present. Now what is interesting is you will notice that the pulmonary artery's location is going to be between the takeoff of the upper lobe and that of the bronchus intermedius. Now just for the sake of understanding, I'll just label them. This is the trachea. This happens to be the right main bronchus. This is your right main bronchus. As it continues beyond, this is what we call it as the bronchus intermedius. As it continues, it is what we call it as the bronchus intermedius. Now, one of the most important things is this junction, I hope everybody knows, this is what we call it as carina. The junction between the right and the left main bronchus is what we call it as carina. So when you measure the distance between the carina, so this is where the carina is present, this distance, that is from where the first upper lobe is taking off, this is a very short distance. It is usually 1 to 2 centimeters, right? On the other hand, your left main bronchus is quite longer. The left main bronchus is going to be at least 3 or 4 times of its initial value, right? So let's say the left main bronchus, it is going to be 4 to 6 centimeters. The left main bronchus is going to measure anywhere between 4 to 6 centimeters. So it is quite long. Now why it is important is whenever you have a tumor that is present in the right main bronchus, it is very difficult for me to operate. I have to take a clear margin. So I have to sacrifice the lung, right? On the other hand, if it is from the left main bronchus, I get good amount of margin. So I can go with sleeve, which we'll talk about it. What is sleeve basically, right? Now, coming back to this discussion that we are having, this is the location of the pulmonary artery. Now you can see that the bronchus is above the pulmonary artery. So this is what we call it as. This bronchus which is above it, this is what we call it as Eparterial. This is what we call it as the Eparterial bronchus. Epa means above the pulmonary artery. So this is your pulmonary artery. Whereas when you see your left main bronchus, the same thing, if I just extend it, the location of the pulmonary artery is quite intriguing. So we'll reconstruct it here. Again, you have the trachea which is present. This is the right main bronchus. This happens to be the left main bronchus. As I told you, it will be around 4 to 6 centimeters. And then you see there is a takeoff for the upper lobe, and then it continues for your lingula as well as your lower lobe. Normally, this again has the same division, which is going to be as we have just learned. So this is going to be S1, which is going to be apical. S2 is going to be lateral, and that is posterior, and this is your anterior, the same thing. But here the pulmonary artery is going to be present here, right? So this is the location of the pulmonary artery, and this is what we call it as the hyparterial. This is what we call it as the hyparterial bronchus. So here the bronchus is present below the pulmonary artery. Eparterial, the bronchus is present above the pulmonary artery, and here it is present under the pulmonary artery. So these are the two important anatomical aspects that you should know on the right and the left side. In the right main bronchus, so when you talk about the right bronchial tree, when you have the takeoff of the upper lobe, the pulmonary artery is below this level. This is eparterial. Here you will see the pulmonary artery rides or resides over the left main bronchus just before the takeoff, and this is what we call it as the hyparterial. There are two important aspects that we should be aware of. Clear? Okay. So this is all in all with respect to your tracheal orientation, right? Now, there is a triangle that you should know in this component where we'll be talking about during the surgeries also. That is what we call it as the triangle of auscultation. Triangle of auscultation. Now, this is an area where it is not covered by muscles, so hence it is easier for me to gain the access and divide the muscles as well. So they've asked you what are the boundaries of the triangle of auscultation, which is on the posterior aspect. So if I give you the posterior aspect of the patient, let's say this is the patient and this is the posterior view of the patient, right? Now, just for the sake of understanding, so the same orientation is present here, and this is going to be the midline. Now, what is the triangle of auscultation? Let's say that this is the representation of the scapula. This is the tip of the scapula. Now, there are two muscles which are going to be present. Number one, you will have the latissimus dorsi. The latissimus dorsi will be adherent here, and this is how the latissimus dorsi would move, right? So you'll see that this is the orientation of the latissimus dorsi muscle. This is the orientation of the latissimus dorsi muscle. There's another muscle which is going to originate from the same segment, but it's going to be slightly onto this side. Now this is what we call it as the trapezius muscle. So you can see that there is a small area between the trapezius. Now this happens to be the scapula. Between the scapula, trapezius and the latissimus dorsi muscle, there is one area which is not guarded by any of them, right? Now this small area which is not guarded by any of them, this is what we call it as the triangle of auscultation, right? This is what we call it as the triangle of auscultation. Right. So triangle of auscultation's boundaries, when you talk about it, if you look at this entire aspect, this is what we call it as the triangle of auscultation. When you look at the triangle of auscultation, this happens to be the scapula. This happens to be the trapezius. This happens to be the trapezius muscle. This happens to be your latissimus dorsi muscle. Right. So this triangular area. So when you look at this, one end of the triangle is formed by your scapula. One end it is formed by the trapezius muscle, and one end it is formed by the latissimus dorsi. Right. So I can just label them as three different ends. This is the medial end, this is the lateral end, this is the inferior end. So medial end is formed by the lateral border of the scapula. Okay, the medial border of the scapula. It is formed by the medial border of the scapula. This is formed by the lateral border is formed by trapezius muscle. And the inferior boundary is formed by latissimus dorsi muscle. It is formed by the latissimus dorsi muscles, right? So this triangle of auscultation is very important, because when you auscultate through here, you can hear this, the breath sounds quite easily and quite evidently. That is the one reason. For me as a surgeon, I will always try to find this area, because when I've given a posterior lateral thoracotomy incision, I will pinpoint the triangle of auscultation, put my finger through it, lift the muscle, because when you go under this, no, you can go directly under your latissimus dorsi muscles. You can see here, I can just lift and my finger will go under the latissimus dorsi, right? So it's easier for me to transact through muscles and then go further, right? So this is your triangle of auscultation, right? So this is all in all that you should know in the context of basic of chest wall anatomy and the lung anatomy, to go forward and nail our topics, right? So from tomorrow, I'll be starting the disorders in the entire context. We'll start with the congenital disorders tomorrow. So we'll talk about the congenital disorders of the lung and their surgical management. Going forward, we'll take another lecture on the infections in lung and their surgical management. And the last lecture will be on lung cancers and its management. That is for thorax. Then you have mediastinal tumors. We'll try to give them as one lecture and try to finish all the concepts of mediastinal tumor. So this is all for today. Thank you so much for watching. I know anatomy is a little bit tedious, but this is the baseline that you have to create before you dive into the subject. Okay? So this is the basic outline of the thorax. I now know that you understand the mechanics of the bronchopulmonary segments. I now know that you know what is the chest wall made up of, what are the intercostal muscles, what are the layers we are going to pierce through. So it becomes very easy for us to go forward and, you know, take the entire lecture per se. Hi Pragati, thank you so much. Guys, see, BLS is a series like, बहुत सारे बच्चे यही सवाल पूछते हैं कि सर ये BLS सीरीज मतलब आपने शुरू किया, इसका ऑब्जेक्टिव क्या है, इसको कैसे अप्रोच करना है? बेटा, BLS इज अ रेप्लिका ऑफ योर बेलियन लव, ठीक है? तो ये वो सीरीज है जहाँ पे एवरीथिंग यू विल गेट इन डिटेल. अगर आपको कोई सवाल आए ना, क्यों, कैसे, हाउ, वाई, व्हेन इन सर्जरी, यू हैव टू गो टू BLS. तो BLS में आपको उसका आंसर मिल जाएगा. ये कॉम्पिटिटिव एग्जाम के लिए नहीं है, बिकॉज इट विल कंज्यूम अ लॉट ऑफ टाइम, ठीक है? जैसे अगर आप देखोगे, हमने ब्रेस्ट पढ़ाया होगा 12-15 घंटे में, हम कॉम्पिटिटिव एग्जाम में 5 से 6 घंटे में पढ़ाते हैं, ठीक है? सो दैट मीन्स दैट इज द अमाउंट ऑफ डेटा दैट इज रिक्वायर्ड. लेकिन अगर आपने पढ़ाई नहीं है सर्जरी, and then you're thinking about attempting surgery, then I would say BLS is a series. अगर आप थर्ड ईयर में हो, अगर आप फाइनल ईयर में हो, अगर आप अपनी इंटर्नशिप के बिगिनिंग में हैं and you want to understand surgery, this is your series. अगर आप कॉम्पिटिटिव एग्जाम में हो, then you have to be very specific. अगर ब्रेस्ट कैंसर का मैनेजमेंट नहीं समझ में आया, आप BLS टाइप करो, ब्रेस्ट कैंसर का मैनेजमेंट, you'll find the answer. अगर आपको ट्रॉमा में कोई स्पेसिफिक कॉन्सेप्ट नहीं समझ में आया, टाइप करो, you will get exact same episode. तो अभी हम स्ट्रीमलाइन कर रहे हैं कि एवरी सिंगल एपिसोड ऑफ BLS इज गोइंग टू बी टैग्ड विद इट्स ओन स्पेसिफिकेशन, ठीक है? आगे चल के ना मैं इंपॉर्टेंट टाइम स्टैम्प्स भी दे दूंगा आपको कि बेटा एग्जाम से पहले ना BLS के इस वीडियो के इस टाइम स्टैम्प पे देख लेना रिव्यू करने के लिए, ताकि आपके प्रॉफ के एग्जाम्स और एज वेल एज योर कॉम्पिटिटिव एग्जाम का अगर कोई स्पेसिफिक पार्ट है. देखो, व्हेन वी कवर, नो, आई ट्राई टू इनकॉर्पोरेट कि बेटा ये आपके INICET में पूछा था, ये NEET PG में पूछा था, ये FMGE में पूछा था, तो दैट आई विल बी डूइंग इट, बट देन फॉर अ वाइडर रेंज ऑफ टॉपिक्स. लेकिन ट्रायंगल ऑफ ऑस्कल्टेशन कोई नहीं पूछता. लेकिन अगर आपने वाइवा देना है, इफ यू आर गोइंग विद मेडिसिन वाइवा, और अगर आप सर्जरी में किसी थोरैक्स के केस में आ गए हो you will be asked. ठीक है? So BLS is a core surgical series. See, it is देखो पूरा ही बेली पे based है. Every single topic, I'm not going to go beyond बेली, लेकिन because I have read couple of more books, I have a little bit of more understanding about a subject, I will bring that also. तो बेली में कुछ चीज़ें जो ढंग से नहीं समझाई गई हैं, हम अपने तरीके से उसको और प्यार से ढंग से समझाते चलेंगे. ठीक है? तो हमारा ऑब्जेक्टिव यही है कि बेटा इसको और स्ट्रीमलाइन करते हुए चलना है, नथिंग मोर अबाउट इट. ठीक है? So with that, thank you so much for joining today. अगर कोई भी सवाल है, कोई भी question है, any queries, anything that you want to ask, you know where to reach out to us. You can give it to the surgery guy. This is my Instagram as well as my Telegram group. It is by my name, that is Dr. Sandeep Sir Reddy. Any questions, any queries, just push it here, right? Thank you so much for joining today. Keep sharing with your friends. Make sure BLS is a hit. I want everybody to have a little bit of BLS in their life of medical journey so that I contribute to your learning. और कुछ सवाल कोई भी है, continue to throw it across. We'll try to answer it. ठीक है? Thank you so much for joining. Until then, see you tomorrow evening at 9 o'clock. Good night. Bye bye. Thank you.